For the inline lunge, begin by placing one foot in front and one foot behind the other. You want to give yourself enough space so that way when your knee comes down, it's going to be directly behind the front foot. So it's going to feel like a tighter lunge than you normally would if you were using weight. And the reason is we're assessing both your balance as well as your range of motion through your hip and your ankle. So you're going to perform 3 reps of lunges, keeping your feet in place, going down and up, and you'll do that on each side. And what you're focusing on is, are you able to keep your balance? Are you able to keep your spine nice and straight and your chest up? And when you dip down, are your feet beginning to rotate out? Is your heel on the front foot starting to lift up? Depending on what you see will help to inform you on what your issue is. So if, for example, when I come down, my front foot starts to elevate off the ground and I can't keep my heel down, then it gives me a pretty good sign that I have some stiffness in that ankle. However, if that foot stays down and this movement's still difficult and I can't actually get all the way down to the ground, then maybe what I'm seeing is stiffness in my quad, my hip flexor. And then if I'm losing my balance and I'm falling from side to side as I come down, then it could be a combination of mobility, but there's probably also some stability factor in potentially your glutes that might be limiting your ability to do the movement. So it's not that you're supposed to diagnose what specifically is going on, but you want to make sure that you pay attention to what is happening while you're performing the movement. And then after performing some corrective exercises, you want to retest and see if it's making a difference. Don't get lost in the weeds of, how do I know if it's stiffness, if it's stability, or if it's strength? You're going to address all of those possibilities and see what begins to make the most difference. And that will help you to know what it actually was that was limiting you to begin with. Pay attention to that front foot and the ankle. Make sure that heel stays down. Make sure that your chest stays nice and straight and that you don't start falling forward. And pay attention to the level of your pelvis, making sure that you don't become uneven while doing this movement. And if you can't control it, it's okay, because it's giving you something to pay attention to and something that you can fix. Take a look at the rest of our channel for helpful exercises and tips on how to fix what you're finding.